What are the differences between COVID-19, influenza, and RSV viruses? Symptoms, testing and treatments. Medium. COVID-19. Patients with COVID-19 exhibit a broader spectrum of symptoms, such as fever or chills, cough, difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Interestingly, the loss of taste and smell is more specific to COVID-19. Influenza. Symptoms are similar to COVID-19, but they usually do not include the loss of taste and smell. Influenza is often accompanied by a rapid onset of symptoms such as high fever, headache, severe muscle aches, cough, sore throat, and fatigue. RSV. Respiratory symptoms are primarily observed, especially in infants and the elderly, with a significant impact. Common symptoms of this condition may include a runny nose, decreased appetite, coughing, sneezing, fever, and wheezing. For young infants, experiencing irritability, decreased activity, and breathing difficulties may be the only symptoms they exhibit. Disease course. COVID-19 can vary in severity from mild to critical. Certain individuals may experience more severe respiratory conditions, such as pneumonia and acute respiratory distress syndrome, ARDS. Long COVID is an intriguing phenomenon with symptoms that persist for weeks or even months. Influenza usually lasts for about a week or two. Certain individuals who are at a higher risk may experience complications such as pneumonia, bronchitis, sinus infections, or a worsening of their existing chronic medical conditions. RSV, typically a mild illness for adults and older healthy children. In infants and the elderly, serious conditions such as bronchiolitis and pneumonia can arise, necessitating hospitalization. Treatments. COVID-19. Various treatment options are available for COVID-19, such as antivirals like Paxlovid and Remdesivir, monoclonal antibodies for specific high-risk patients, and supportive care. The role of steroids in certain situations. Influenza. Antiviral medications like oseltamivir can be quite effective, particularly if taken within 48 hours of experiencing symptoms. It's crucial to prioritize supportive care as well. RSV. Primarily focused on providing supportive care such as oxygen and hydration. In more serious situations, hospitalization may be necessary. Prophylactic use of palivizumab for infants at high risk. Testing and follow-up. COVID-19 PCR and rapid antigen tests are commonly employed. Follow-up is necessary based on the severity of symptoms, with a primary emphasis on closely monitoring for any signs of respiratory distress. Influenza. Rapid influenza diagnostic tests, RIDTs, and PCR tests. Outpatient follow-up is centered around effectively managing symptoms and closely monitoring for any potential complications. Diagnosis of RSV is typically done using rapid antigen detection tests and PCR. Follow-up is crucial for high-risk groups such as infants and the elderly. Preventing complications. COVID-19 vaccination, including booster doses. It is important to take preventive measures such as wearing masks, practicing social distancing, and maintaining good hand hygiene. Ensuring prompt intervention for individuals at high risk. Annual vaccination for influenza. Preventing viral infections in vulnerable populations. It's important to take general preventive measures, such as practicing good hand hygiene and avoiding close contact with individuals who are sick. RSV. Palivizumab is used to provide prophylaxis for high-risk infants. It is essential to grasp these distinctions in order to effectively prevent, diagnose, and treat these respiratory infections. Furthermore, it is crucial to stay updated with the most recent health guidelines and research, as recommendations and treatments may change over time. Reference CDC. Disclaimer for MD Talk Health and Fitness. YourMD.online LLC. Welcome to MD Talk Health and Fitness, a YouTube channel operated by YourMD.online LLC in collaboration with United Medical Group. Our content, including the various playlists such as MediNurse Essentials, India Fit, Yoga Sense, Health AI, Fit Revolution, Skin Saver Central, and others, is designed to provide educational and informative healthcare information. Please note the following important points. Educational purpose only. The information provided on this channel and in our videos is for educational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. No doctor-patient relationship. The use of our content, including interactions in the comments section, does not create a doctor-patient relationship between you and any of the medical professionals or experts featured here. Accuracy and currency of information. While we strive to present up-to-date information, we cannot guarantee that all the content reflects the most current research or medical guidelines. Please consult a medical professional for the most current advice. 4. Diverse opinions, health and fitness topics can be subject to different interpretations. Our channel may present multiple viewpoints which do not necessarily represent the official policy or position of YourMD.online LLC or United Medical Group. Liability. YourMD.online LLC, United Medical Group, and all associated persons or entities involved in the production of this channel shall not be held liable for any direct or indirect harm resulting from the use or interpretation of the content. Third-party links. Our channel may include links to third-party websites. We are not responsible for the contents or reliability of these websites and do not necessarily endorse the views expressed within them. By using our channel, you acknowledge and agree to these terms.